Hello everyone, I am Dr. Vivek Venkatramani, consultant uro-oncologist in Mumbai. Today we'll talk a bit about benign prostatic enlargement, which is also known as benign prostatic hyperplasia, BPH or BEP. This is actually a normal process of aging, and in that the prostate, due to certain hormonal changes, enlarges in size and can produce symptoms on the man's urination. The exact cause of this is unknown, and it's generally seen in about 50% of men after the age of 50 and almost 90% after the age of 80. This occurs due to certain aging and hormonal changes within the prostate. So the prostate is basically a small gland just below the urinary bladder and around the urethra or the urinary passage, which takes urine out of the body. Its main function in life is basically in reproduction, where it produces certain substances to nourish the sperm, and after aging of 50 or 60, it begins to enlarge in size and can cause certain symptoms. When the prostate grows into the urinary bladder, it produces an obstruction to the urine. So the man may take a long time to start the urine or complete the urination. The stream may become much slower, and there may be just some dribbling of urine. If the gland is very big, the stream may get interrupted and the man may have to strain in order to complete his urination. And he may also feel that he hasn't emptied fully and need to keep going again and again to empty the bladder completely. With time, this also affects the bladder, because the bladder then becomes more and more irritable, and this causes what we call urgency, where it's difficult to hold the urine and it may even leak out before the man can reach the bathroom. Nighttime urination or nocturia, where the man has to typically wake up at least 2-3 times at night to pass urine, can also be a symptom of the enlargement of the prostate. Rarely there may be blood in the urine because the prostate has enlarged so much, or this may also cause repeated urinary infections because urine remains stagnant within the bladder and is more prone to be infected. Not all men with benign enlargement of the prostate need treatment. Those with symptoms would definitely need certain medications or surgeries, which we will discuss in detail. Those without symptoms can be carefully monitored by their symptom score, by checking the PSA to make sure there's no risk of prostate cancer, and by regular ultrasounds every year or two to assess the prostate size and how much urine is remaining inside the bladder at the end of urination. Based on these, we may then recommend certain non-medicatory treatments or medications or surgery. The common medications that are used for the prostate enlargement are alpha blockers or 5-alpha reductase inhibitors. Sometimes we use a combination of these medications. The function of these, the alpha blockers, is to relax the bladder neck, which allows the flow of urine to increase. Some commonly used ones are tamsulosin and silodosin. They are quite safe. They have really minimal side effects. Only in the first couple of doses, they may cause a little drop in blood pressure. So we recommend it to be taken at bedtime. And after that, generally they are completely safe and can be used for many years together. And a lot of men get complete relief from their symptoms with the medication, and many of them really don't need to have surgery because they are well controlled. The second type of medication, the 5-alpha reductase inhibitors, we use when the prostate is above 35 to 40 grams in size, because this helps to shrink the size of the prostate, and over 3 to 6 months of treatment, it can shrink by as much as 30 to 50%. So this allows us again to control the symptoms for a long duration of time. There are many surgeries that are available to treat benign enlargement of the prostate. Surgery is needed, one, when the medications are having no effect anymore and the man is really frustrated and wants to, have a more permanent solution. Second, if there are any complications due to this enlargement of the prostate, generally surgery is needed. So what are these complications? First is what is known as retention of urine, when the urine completely stops and we have to put in a catheter to drain the urine. So then we are left with kind of no choice but to go ahead with surgery. Second, if there's so much urine remaining inside that the kidneys are getting affected because they cannot empty completely into the bladder. So that is one reason where we have to decompress it with the surgery, and that allows the kidney function to recover. Third, if there is repeated urinary infections due to the prostatic obstruction or recurrent bleeding due to the size of the prostate, then we may need to go ahead with surgery. So these are the kind of reasons where we do surgery. Surgery is generally done endoscopically, which is known as a TURP. So through the urine passage, we insert a camera and we remove the prostate, scrape out what is blocking the urination and create a wide channel for the man to pass urine much better. So the flow after prostate surgery improves in 90% of cases. And it's a very durable response. More than 90% of men will be absolutely fine over the next 15-20 years. There's a recurrence rate of about 10% over 10 years. So it's a very safe, effective procedure and it works really well. In men who have very large prostates, more than 60 to 80 grams, we may need to do what is called a laser prostatectomy, where again it's an endoscopic procedure through the urinary passage. And this allows us to take out these large prostate glands in their entirety and then it's made into small pieces and removed. Laser is also especially helpful if a man has cardiac problems and blood thinners which cannot be stopped because the bleeding may be reduced by the use of the laser. Finally, in very, very large prostates, more than 100-120 grams, we may do what is called an open or robotic enucleation of the prostate. In the past, about 15 to 20 years ago and even before that, these were some of the earliest surgeries described for treating a prostatic obstruction, which was the open prostatectomy. But it is quite a major surgery. There is a risk of bleeding. The patient may need to be hospitalized for at least 5 to 7 days and the catheter is there for about 2 weeks. So this is now kind of given up, especially since we have the robotic approach where we are able to do exactly what we did in the open approach, but with a minimally invasive and very precise way. And we can take out glands up to 200-300 grams. There's no upper limit to the size of prostate we can remove by these approaches. So we tailor the treatment depending on the patient's symptoms and depending on the size of the prostate. And we have a huge number of treatments, whether it's non-medical, medications and surgical for treatment of benign prostatic enlargement. If you found this video informative, please like and share it and please subscribe to my YouTube channel. Thank you.